Hello, my name is Mario Martinez. This is my ID. My outreach video project, it's on the physiological effects of diabetes type 2. The target audience is anyone who is interested in taking care of their health in regards to type 2 diabetes mellitus. Based on my background working with patients in the Hispanic community, my objective is to reach and try to educate this group of the population. The experience that I had working with this group brings me to think that they are either undereducated in their health or lack the interest to learn how to take care of their health. First, we're going to start with the basic overview of type 2 diabetes mellitus. Type 2 diabetes mellitus is one of the most common metabolic disorders worldwide. It is primarily caused by a combination of two factors: defective insulin secretion by the pancreatic B cells and the inability of insulin-sensitive tissues to respond to insulin. Insulin release and action must precisely meet the metabolic demand. Hence, the molecular mechanism involved in the synthesis and release of insulin, as well as the insulin response in tissues, must be tightly regulated. In simpler terms, as described by Dr. Martinez-Amado, MD, in an article from News Medical, type 2 diabetes is caused by either inadequate production of the hormone insulin or a lack of response to insulin by various cells of the body. Risk factors for type 2 diabetes mellitus, as presented on the article Understanding the Growing Epidemic of Type 2 Diabetes in the Hispanic Population Living in the United States by the National Library of Medicine. Genetic predisposition is a main cause for type 2 diabetes mellitus because Hispanics are more insulin resistant than non-Hispanic whites, posing them at a greater risk of developing type 2 diabetes. Although the specific genetic abnormalities conducive to these disturbances in this ethnic group are not clear, their multiple genetic ancestors might contribute to this phenotype. The prevalence and incidence of type 2 diabetes among the Hispanic population in the United States are higher than national average. This is partly due to the social cultural factors such as lower income and decreased access to education and healthcare, as well as genetic susceptibility to obesity and higher insulin resistance. Hispanics are the largest minority in the United States and have higher rates of diabetes in both adults and children. Next, we're going to talk about the physiological complication with other organs due to type 2 diabetes. As stated in Science Direct article Type 2 Diabetes Mellitus that concern complications and target organs, some of the major complications include coronary artery disease, stroke, peripheral vascular disorders, nephropathy, neuropathy, diabetic retinopathy, and people having diabetes have a greater risk of acquiring cancer, cardiovascular complications, and renal failure. Next, the physiological function of insulin and other medication to help control diabetes. Insulin therapy has been in use now for 100 years, but only recently insulin replacement has been based on physiology. The pancreas secretes insulin at continuously variable rates, finely regulated by sensitive arterial glucose sensing. The breakthrough in understanding the physiology of insulin was pivotal to designing the basis of the modern strategies of insulin replacement, which have been in continuing evolution until present times. Other complications, other options that the patients might have to control the glucose. Type 2 diabetes is a complex disorder with this diminished insulin secretion and insulin action contributing to hyperglycemia, and wide range of metabolic defects that underlie the disease. The contribution of glucose metabolic pathways in the pathogenesis of the disease remain unclear. The cellular fate of glucose begins with glucose transport and phosphorylation. Subsequent pathways of glucose utilization include aerobic and anaerobic glycolysis, glycogen formation, and conversion to other intermediates in the exose, phosphate, exosamine biosynthesis pathways, as presented in Oxford's academic article titled "The Cellular Fate of Glucose and Its Relevance in Type 2 Diabetes." Sorry for my hoarseness. Thank you.